All right, deep divers, are you ready to go deep?
Always ready to dive in.
Okay, awesome. Today we're tackling a topic that I know a lot of you have been requesting, hernia repair.
Uh-huh.
Specifically, we're going to be looking at the risk of infection after you have surgery to repair a hernia.
Yep.
So, to help us unpack all of this, we have excerpts from a medical publication titled Wound Infections Following Abdominal Wall Hernia Repair,
Yeah.
Epidemiology, Pathogenesis, and Prevention.
Sounds pretty dense.
Does sound a little intimidating, but we're going to break it down for you, I promise. The good news is that hernia repairs are generally safe procedures,
Yeah, for sure.
but infections can happen, and certain factors can increase or decrease your risk.
Right.
So that's our mission for this deep dive.
All right, let's do it.
We're going to figure out what those factors are so that you can have the best possible outcome after your hernia surgery.
Exactly.
So first things first, I think it's important to understand that the risk of infection isn't just like a one-size-fits-all thing. There are multiple factors that come into play.
Yeah.
And those factors can be kind of categorized into two buckets.
Oh, wow.
It's like things about you,
Yeah.
the patient,
Yeah.
and then there are things about the surgery itself.
Right.
So we kind of have to look at both sides of that coin. What do you think?
Yeah, absolutely. And I mean, patients, they really appreciate understanding, what are the things about them that might make them at higher risk? And then what are the things about the surgery that might put them at higher risk?
Okay, so let's tackle the you factor first.
Yeah.
What are some of the things about a patient that might make them more likely to develop an infection after a hernia repair?
So the paper that we're looking at, it refers to these as clinical predictors, but we can just call them risk factors.
Okay.
And some of the common ones that we see are things like obesity,
Oh, okay.
diabetes,
Mm-hmm.
smoking,
Okay.
heart failure. So these are all things that, if a patient has these conditions, it doesn't mean that they can't have surgery.
That's right.
But it just means that they may be at a slightly higher risk of developing an infection afterwards.
Got it. So it's not a deal breaker, but it's something to be aware of and to discuss with your surgeon
Exactly.
so that they can take extra precautions, perhaps.
Exactly. Exactly.
Okay. Now let's talk about those surgery factors. What are some things that might happen during the surgery itself that could make an infection more likely?
Yeah. So, we can think about, if there were any complications during the surgery.
Okay.
For example, if part of the bowel needed to be removed,
Oh, wow.
that's called a bowel resection,
Huh.
or if it was an emergency surgery. These are all things that can increase the risk of infection.
And why is that? Why would a more complicated surgery or an emergency surgery lead to a higher risk of infection?
Well, I mean, you can imagine if the surgery is more complicated or it takes longer, there's just more opportunity for bacteria to get into the wound. And then in an emergency surgery, sometimes the tissues are not as healthy. There might be more inflammation or damage already present.
That makes sense.
Oh.
Okay. So we've talked about the you factors and the surgery factors. Now let's move on to something a little more specific.
Yeah.
The location of the hernia. Because we know that hernias can happen in different parts of the body.
Yeah.
Does that location play a role in infection risk? Like, for example, is an inguinal hernia, which is in the groin, more or less likely to get infected than a ventral hernia, which is in the belly?
That's a great question. And, we see that ventral hernias, so the ones in the belly, they tend to have a higher risk of infection compared to inguinal hernias.
Interesting. So even though inguinal hernias are way more common, the ventral hernias are actually riskier.
It seems that way. But, it's not just about the location. The size of the hernia also plays a role. Larger hernias require a larger repair, and that can increase the risk of infection as well.
Okay, so it's a combination of location and size. Got it. Now let's talk about the different surgical techniques that are used to repair hernias. We've all heard of open surgery versus laparoscopic surgery. Is one better than the other when it comes to infection risk?
Well, with open surgery, the surgeon makes a larger incision to directly access the hernia. Laparoscopic surgery, on the other hand, uses small incisions and specialized instruments to repair the hernia.
So laparoscopic is like less invasive, right?
Exactly. And because the incisions are smaller, there's a lower risk of superficial wound infections.
That makes sense. So laparoscopic is always the better option, right?
Well, not always. While laparoscopic surgery might have a lower risk of those surface infections, when it comes to deep infections, the risk is about the same for both techniques.
Okay, so laparoscopic might be better for preventing those minor infections, but if a deeper infection happens, it's just as serious regardless of how they got in there.
That's right.
All right. Let's tackle a topic that I know causes a lot of confusion and questions. Mesh. Mesh is commonly used in hernia repairs, but there's a lot of debate about whether it increases the risk of infection. What does the research say?
You're right, there is a lot of back and forth on that. Some studies do suggest that using mesh might increase the risk of infection compared to repairs done with sutures alone.
Okay.
But other studies have found no difference in infection rates between the two methods. So it's not a simple answer.
So it's not as simple as mesh is bad or mesh is good.
Right.
It sounds like it really depends on the specific situation.
Exactly. And I think the type of mesh used probably plays a role too.
Okay, so let's talk about the different types of mesh, because there are a few, right? I've heard about permanent mesh and absorbable mesh.
Yep. Permanent mesh is designed to stay in the body permanently, providing long-term support. Absorbable mesh, on the other hand, is designed to gradually break down and be absorbed by the body over time.
So is one type riskier than the other in terms of infection?
Interestingly, permanent mesh is generally considered to have a lower risk of infection.
Oh, really? Why is that? I would think that something that stays in your body forever would be more likely to cause problems.
It might seem counterintuitive, but researchers think that permanent mesh integrates better with the body's tissues, creating a more stable environment. And that stability might make it harder for bacteria to take hold and cause an infection.
That's fascinating. So it's almost like it becomes part of your body.
In a way, yes. Now, there's also a newer type of permanent mesh that we should mention, human acellular dermal matrix, or HADM.
HADM, that sounds pretty high-tech.
It is. It's made from donated human skin that's been processed to remove the cells, leaving behind a sort of biological scaffold.
Wow, so they're basically using human skin to repair hernias.
Yep, pretty cool, huh? But here's the thing. While HADM has shown a lot of promise, some studies have shown that it might actually have a higher risk of infection in certain situations.
Like what kind of situation?
Well, if the bowel was involved in the hernia repair, or if the patient's tissues weren't very healthy to begin with.
Okay, so it's not a magic bullet, but it's definitely an interesting development. Now, besides the type of mesh, does the placement of the mesh matter when it comes to infection risk?
It's a good question, and researchers have looked into that. It seems that the placement of the mesh, whether it's on top of the muscle, underneath the muscle, or within the abdominal cavity, doesn't really have a big impact on infection rates.
Okay, so it's not like putting the mesh on top of something is automatically safer than tucking it underneath.
Right.
Got it. Now, last question on this mesh topic, surgical drains. Those little tubes they sometimes put in to help drain fluid after surgery, I've heard that they can actually increase the risk of infection. Is that true?
You know, it might sound counterintuitive, but yes, drains can sometimes act as a pathway for bacteria to enter the wound.
Ugh, that's kind of gross to think about.
Yeah, not the most pleasant image.
So why do they even use drains if they can be so risky?
Well, in some cases, the benefits of using a drain, like preventing fluid buildup, outweigh the risks. But the decision to use a drain or not is always made on a case-by-case basis.
So it's a judgment call by the surgeon based on the individual patient and the surgery itself.
Exactly.
Okay, now let's talk about a specific type of hernia that sounds pretty scary. An incarcerated hernia. What exactly does that mean? And does it change anything in terms of infection risk?
An incarcerated hernia is when a portion of the intestine or other tissue gets trapped in the hernia and can't be pushed back in.
Oh, wow. So it's like the hernia gets stuck.
Right. And it can be a serious problem if it's not treated promptly.
So if someone has an incarcerated hernia that needs surgery, does that make them more likely to get an infection?
Well, incarcerated hernias often require more complex surgery, which, as we discussed earlier, can increase the risk of infection in general.
Right.
But the good news is that studies have shown that even in cases of incarcerated hernias, using mesh doesn't seem to increase the infection risk any further.
That's good to know. So even in a more urgent situation, mesh can still be a safe and effective option.
That's right.
But why does mesh sometimes lead to infections in the first place? What's actually happening at a cellular level?
Well, you have to remember that mesh is a foreign material. And when you introduce a foreign material into the body, it can disrupt the normal healing process.
Okay.
This disruption can lead to things like reduced blood flow to the area and changes in the way the immune system functions. And those changes can create a more favorable environment for bacteria to grow and cause an infection.
So it's not that the mesh itself is infected, it's more that it creates a vulnerability.
Exactly.
Okay, so we've talked about all these factors that can increase the risk of infection after hernia surgery. But the good news is there are also things that can be done to prevent infections. right?
Absolutely. Preventing infection is a top priority for surgeons, and there are a number of strategies that we use.
Like what?
Well, a very basic but crucial step is proper skin preparation before surgery.
So just making sure the area is clean.
More than just clean, we use special antiseptic solutions to kill any bacteria that might be present on the skin.
Okay, so it's like sterilizing the area.
Exactly. And then antibiotics are also a key part of infection prevention.
Oh, right, antibiotics. So they give you antibiotics before surgery to kill any bacteria that might be lurking around.
Yep. And we usually give them intravenously right before the surgery starts.
Okay, so it's like sending in the troops before the battle even begins. And what specific antibiotics are typically used for this?
Cefazolin is a common choice. It's a broad-spectrum antibiotic that covers a wide range of bacteria.
Okay.
And if someone is allergic to penicillin, we might use vancomycin instead.
So there are options depending on the individual patient. Now, I'm curious, are there any other ways to deliver antibiotics besides an IV? Like, are there any more targeted approaches?
Yeah, that's a good question. And there are some interesting techniques being developed. One approach is to irrigate the surgical site with a gentamicin solution during the surgery.
So they basically wash the area with antibiotics.
Yep. And that can help to kill any bacteria that might be present.
Okay. What else?
Another technique is to use special tampons that are soaked in gentamicin.
Tampons, like for,
No, not those kinds of tampons. These are special surgical tampons that are placed near the mesh during surgery.
oh, okay.
And as the tampons dissolve, they release the gentamicin slowly, providing ongoing protection against infection.
That's so cool. It's like having a little time-release antibiotic capsule right where you need it.
Exactly. And then there's also research being done on mesh that is coated with antimicrobial agents.
So the mesh itself is like a weapon against bacteria.
That's the idea.
Wow, that's amazing. It's like they're building a fortress against infection right into the mesh. So it sounds like there are a lot of promising developments in the world of hernia repair and infection prevention.
Definitely. And we're always looking for ways to improve patient outcomes.
That's great to hear. So deep divers, I think we've covered a lot of ground here in part one. We've talked about the U factors and the surgery factors that can increase the risk of infection after a hernia repair. And we've explored some of the cutting-edge techniques that are being used to prevent infections. But we're not done yet.
No, we're not.
In part two, we're going to tackle the big question. What happens if, despite all these precautions, you do get an infection?
Right.
We'll talk about the signs and symptoms of infection, how infections are treated, and what you can expect during the recovery process. So stay tuned.
We'll be right back.
All right, deep divers, welcome back.
Part 2, here we go.
In part one, we did a deep dive into all of those risk factors that can up your chances of getting an infection after you've had surgery to fix a hernia. But we also know that sometimes, even when you take every precaution, infections can still happen.
Yeah, unfortunately, that's true.
So let's not shy away from the elephant in the room, right? Let's talk about what happens if you get an infection. What are some of the red flags, the signs and symptoms that should send you running back to your doctor?
Well, I mean, a lot of the same things that you would see with any infection, right? Like redness, swelling, and pain around the incision site.
Okay, so not just a little tenderness. It's really noticeable.
Right. And maybe some warmth or even pus or drainage coming from the wound.
Oh, yuck. Okay, so those are all pretty clear signs that something is wrong. But let's say you're recovering from surgery and you start to notice a few of those things. What should you do? I mean, is it always an emergency?
Well, I would say it's always best to err on the side of caution. So if you have any concerns at all, definitely reach out to your doctor.
Don't just wait and see.
Right. It's much better to get checked out and make sure everything is okay than to ignore it and risk things getting worse.
That's good advice. So let's say you do have an infection. How is that typically treated?
Well, it kind of depends on the severity of the infection.
Oh.
For, mild cases, oral antibiotics might be enough. But for more serious infections, you might need intravenous antibiotics.
Oh, so through an IV.
Yep. And in some cases, surgery might even be needed to drain the infection.
So it can range from a simple pill to a more invasive procedure.
Right.
Now, what about the mesh? If there's an infection, does that mean the mesh always has to come out?
That's a really common question, and it's understandable, right? Nobody wants to have another surgery if they can avoid it.
Yeah, of course not.
So removing the mesh is sometimes necessary, but not always.
Okay.
Especially if the infection is severe or if it doesn't respond to other treatments. But a lot of times we can treat the infection without removing the mesh.
So they try to save the mesh whenever possible.
Right.
Okay. Now, I remember in part one, we talked about some of those newer techniques that are being used to prevent infections, like those special tampons that are soaked in gentamicin.
Yeah.
How effective are those?
Well, they seem to be pretty effective, actually. Studies have shown that using those tampons can significantly reduce the risk of infection, especially in inguinal hernia repairs.
That's really good news.
It is.
I mean, anything that can help to prevent those complications is a huge win, right?
Absolutely.
Now, what about those meshes that are coated with silver chlorhexidine?
Oh, yeah. Those are pretty cool.
Right. It's like high-tech mesh. Have they proven to be effective as well?
Well, the early research is promising. It suggests that the silver chlorhexidine coating does help to reduce infection rates.
Okay.
But like any new technology, we need more research to really know for sure.
Got it. So for our listeners who might be feeling a little overwhelmed by all of this, let's just break it down into some key takeaways. What are the most important things they should remember about infection prevention and management after hernia surgery?
Okay. So, number one, talk to your doctor.
Okay.
Communication is key. Tell them about your medical history, any concerns you have, ask questions.
Be your own advocate.
Exactly. Number two, follow your doctor's instructions carefully, especially when it comes to wound care.
Okay, so keep it clean and dry.
Yep. And finally, if you notice any signs of infection, don't wait. Call your doctor right away.
So be vigilant, basically.
Exactly.
Now, before we move on to part three, I want to touch on something that I think is really important, and that's the psychological impact of dealing with a potential infection.
Uh-huh.
Because, surgery is already a stressful experience.
Yeah.
And then if you add on top of that the worry and the discomfort of an infection, it can be really tough emotionally.
Yeah, it can be really challenging. And, people often feel isolated or alone when they're going through something like this. So it's really important to reach out for support.
Absolutely. Talk to your loved ones, connect with support groups, or even seek professional help if you need it.
It's okay to ask for help.
Don't try to go through it alone. All right, deep divers. We've covered a lot in this part, but in part three, we're going to bring all of this to life with some real-world case studies that'll help you understand how these concepts play out in real patients' lives.
Yeah, case studies are really helpful.
So stay tuned for that. We'll be right back. Welcome back, deep divers. For this final part of our hernia repair deep dive, we're going to switch gears a bit
Okay.
and look at some real-world case studies.
Yeah, I like case studies.
Because I think sometimes it helps to really bring all of this information to life.
Right.
When you can see how these concepts play out in real patients' lives.
It makes it more real.
Yeah, exactly. So let's dive into our first case. Okay. Imagine a 50-year-old man. We'll call him Mr. Smith.
Oh.
He's a smoker and has diabetes. And he undergoes an open inguinal hernia repair
Okay.
using mesh. A few days after the surgery, he starts experiencing redness, swelling, and pain at the incision site. What's going on here?
So unfortunately, this is something that we see sometimes. Mr. Smith had a couple of those risk factors that we talked about.
Right.
He's a smoker. He has diabetes.
Both of those things can make it harder for the body to heal.
Exactly. And fight off infection.
Right.
And then open procedure, with that larger incision that could have also increased his risk.
So it's like all those things together kind of created the perfect storm.
Yeah, sometimes it's just bad luck.
So how would a case like this typically be managed?
Well, the first thing would be to confirm that it is actually an infection.
Okay.
Sometimes it can be hard to tell, especially early on.
Right.
So the doctor would probably examine the wound, maybe order some blood tests.
Okay.
And then depending on how serious the infection is, they might prescribe antibiotics.
Okay.
Either oral antibiotics or intravenous antibiotics if it's a more serious infection.
Okay.
And of course, they would also need to monitor the wound closely to make sure that the infection is clearing up.
Okay, so it's all about being really vigilant and making sure that the infection is being treated effectively.
Right.
Now, let's move on to our next case, okay? Let's say we have a 35-year-old woman, we'll call her Mrs. Jones.
Okay.
She had a laparoscopic ventral hernia repair
Okay.
using that HADM mesh.
Right, the human cellular dermal matrix.
Yes. But a few weeks after the surgery, she starts having some persistent pain.
Oh, no.
And she even develops a fever.
Oh, that's not good.
So what could be going on here?
Well, it's important to remember that even with these minimally invasive techniques and these newer materials, like HADM,
Right.
there's still a risk of complications.
Yeah.
And, we talked about how HADM can sometimes be associated with a higher risk of infection.
Especially in certain situations.
Exactly. Like
Yeah.
if the bowel was involved in the hernia repair or if the patient's tissues weren't in great shape to begin with.
Right. So even though the surgery itself was less invasive, the mesh itself might be causing problems.
It's possible.
So how would doctors approach a case like this?
Well, they would want to do a thorough evaluation, of course.
Okay.
Maybe order some imaging studies to see what's going on with the mesh and the surrounding tissues.
Okay.
And if it turns out that there is an infection, they might need to treat it with a longer course of antibiotics.
Okay.
And in some cases, they might even need to surgically remove the mesh.
So it can be a tricky situation,
It can be.
but the important thing is to catch it early and get the right treatment.
Right.
Okay, for our last case study, I want to shift gears a bit and focus on prevention.
Okay. Sounds good.
So let's say we have a 60-year-old woman, Mrs. Davis.
Mm-hmm.
She's scheduled for an inguinal hernia repair using mesh.
Okay.
She's generally healthy,
Good.
but, understandably, she's a little nervous about the risk of infection.
Of course.
So what are some things that she can do proactively to try to minimize her risk?
I think the most important thing is communication.
Okay.
She should talk to her surgeon. Tell them about her medical history.
Yeah.
Any medications she's taking, any lifestyle factors that might be relevant.
Okay.
And that way, the surgeon can really tailor the approach to her specific needs and try to minimize her risk.
So it's a partnership, basically.
Exactly.
Now, are there any lifestyle changes that she could make that might help?
Well, if she's a smoker, quitting smoking, even temporarily, would be a huge help.
Fine.
Because smoking really impairs wound healing
Right.
and increases the risk of infection.
Makes sense. So anything she can do to support her body's natural healing process.
Exactly.
Now, what about during the surgery itself? Are there any preventative measures that the surgeon might take?
Yeah, definitely. We talked about some of those newer techniques like irrigating the surgical site with gentamicin
Mm-hmm.
or using mesh that's coated with antimicrobial agents.
Right.
Those are all things that the surgeon might consider to try to reduce the risk of infection.
It's like adding an extra layer of protection. So these case studies, I think they really highlight the fact that hernia repair is not like a one-size-fits-all thing.
Yeah.
There are so many factors that come into play.
Mhm.
And it's really about individualized care, finding the best approach for each patient.
Absolutely.
Well, deep divers, we've reached the end of our deep dive into hernia repair and infection risk.
It's been quite a journey.
It has. We've covered a lot of ground, but hopefully you've learned some valuable information that will help you make informed decisions about your health.
I hope so.
Remember, knowledge is power, and being informed is the first step.
Right.
Don't be afraid to ask questions. Advocate for yourself, and if you ever have any doubts or concerns.
Talk to your doctor.
Exactly. All right, deep divers, until next time, stay curious, keep learning, and take care of yourself.